It started as just a small itch, barely noticeable. Margaret, 67, figured it was dry skin, maybe from the weather or an allergy. She didn't think much of it at first. After all, who hasn't had an annoying spot of itching from time to time? But weeks passed, and the itch didn't go away. It didn't seem to improve with lotions or moisturizers, and it only seemed to intensify. Margaret began to feel uneasy. The itch wasn't just annoying anymore. It was a constant companion, distracting her throughout the day and even keeping her up at night. She started to scratch it absent-mindedly, but that only made things worse. The skin around the spot became irritated, inflamed, and more tender. Her daughter, concerned about the persistent itching, encouraged Margaret to schedule a checkup with her doctor. It wasn't until that routine visit when her doctor raised an eyebrow and asked to take a closer look. After a careful examination, he didn't seem convinced that the itchy spot was simply a case of dry skin. The doctor recommended some additional tests, just to rule out any underlying issues. A few weeks later, Margaret got the call. The results were alarming. The itchy spot was indicative of a much more serious issue. It wasn't just a harmless irritation, it was a red flag for a more profound health concern. The doctor explained that persistent, unexplained itching in older adults could signal several underlying health problems, ranging from liver disease to even cancer, and ignoring it could be risky. This situation may sound dramatic, but it's a reality that many seniors face. Margaret's story is not unique, and it serves as a warning. An itchy spot that doesn't go away is often more than just a nuisance. It could be your body's way of signaling that something deeper is going on, something that shouldn't be ignored. In fact, research has shown that persistent itching in older adults, especially after 60, can often point to more serious health issues that require medical attention. These conditions, while often silent, can be detected early with the right approach and lead to better outcomes. For seniors, the body's response to itching might seem like a minor inconvenience, but it's crucial to recognize when it's more than that. What might seem like an insignificant symptom can often be the first sign of something more concerning, such as liver dysfunction, kidney disease, or even a blood disorder. What started as a minor itch for Margaret led her down a path that ultimately saved her health and potentially her life. In this article, we'll explore why that itchy spot could be signaling that something is wrong inside your body, and why it's essential not to ignore the warning signs. Ignoring such symptoms can be dangerous. In many cases, it's not just the itch that's the problem, but the underlying condition causing it. The itchy spot that Margaret had might seem like a simple issue, but it could have been the first indication that her liver wasn't functioning properly. Other times, it could be a symptom of more chronic health issues such as kidney failure or diabetes, which can manifest in subtle ways. As we age, our bodies become less resilient, and symptoms that once would have gone unnoticed or been shrugged off can now be signs of serious illness. It's not uncommon for the elderly to underestimate or dismiss these signs, thinking they're simply a part of getting older. That's why it's essential to stay vigilant. If you or a loved one experiences persistent itching, especially if it is localized to one area of the body and doesn't improve with usual remedies like moisturizing, it's time to consult a doctor. Early detection of any underlying condition can make all the difference, allowing for proper treatment and intervention before things escalate. In the end, Margaret's decision to act on her doctor's advice proved life-changing. Her health was saved because she didn't ignore what started as a small, irritating spot on her skin. Her story is a reminder for all of us. Don't take any unexplained symptoms lightly, especially after the age of 60. The body has a way of sending us signals, and it's up to us to listen closely. That itchy spot might be trying to tell you something far more important than you realize. So, the next time you experience persistent itching, don't brush it off as just another part of aging. Get it checked out. It could be the key to preventing something much worse. The mystery of the itchy spot. Imagine waking up one morning and noticing a small, itchy spot on your body. Maybe it's on your arm, your back, or your leg. It doesn't seem like a big deal, At first, you think it's just dry skin, perhaps a reaction to something you ate or an insect bite. So you apply some lotion, pop an antihistamine, and go about your day, confident it'll pass. But over the next few days, the itch doesn't subside. In fact, it seems to intensify. No matter how much lotion you use or how many antihistamines you take, the irritation persists, becoming a constant distraction throughout the day and even disturbing your sleep. The more you try to ignore it, the worse it gets. This scenario, while it may seem trivial, is incredibly common among seniors. Itchy spots are often brushed off as inconsequential, just another annoyance that comes with aging. But what if that seemingly harmless itch is telling you something much more significant about your health? After all, the skin is the body's largest organ, and it serves as an outward reflection of our internal health. When it begins to show signs of irritation or distress, it's often a signal that something is wrong beneath the surface. The connection between skin and health. As we get older, our skin undergoes several natural changes. It becomes thinner, less elastic, and less able to retain moisture, leading to dryness. These changes can make the skin more prone to irritation, especially when exposed to environmental factors such as cold weather, sun exposure, or harsh soaps. However, there's a fine line between ordinary skin irritation and something more serious. Persistent or unexplained itching in elderly individuals, particularly when it doesn't respond to typical remedies like lotion or antihistamines, can be a red flag. It's a signal that there might be deeper issues at play, possibly involving your internal organs. The skin is not just a physical barrier, it's also a mirror of what's happening inside the body. When you experience persistent itching, your skin could be reflecting internal conditions like liver disease, kidney problems, or even blood disorders. As we age, we become more susceptible to these conditions, and itching is often one of the first signs that something is amiss. So, while that itchy spot might seem harmless, it could be an early warning sign of a potentially life-threatening issue. Potential causes of persistent itching. After 60, liver disease, one of the most important things to understand about persistent itching in seniors is its potential connection to liver disease. The liver plays a critical role in detoxifying the body, filtering out harmful substances, and producing bile that helps with digestion. However, as we age, the liver's ability to perform these functions can decline. This slowing of liver function can lead to a buildup of bile salts in the body. These salts can accumulate in the skin, causing intense itching, especially in areas like the palms of your hands or the soles of your feet. If you notice itching that won't go away, along with symptoms such as fatigue, yellowing of the skin or eyes, jaundice, or dark urine, it's essential to see a doctor as soon as possible. These could be signs of liver conditions like cirrhosis or hepatitis, both of which can be life-threatening if left untreated. Liver disease often progresses slowly, so by the time symptoms like persistent itching appear, the condition could already be advanced. Early detection is key to managing liver disease and preventing further complications. Kidney problems. Another potential cause of persistent itching in older adults is kidney disease. The kidneys are responsible for filtering waste from the blood, and when they begin to fail, toxins can build up in the body. This accumulation of waste can lead to a range of symptoms, one of which is chronic itching. Kidney disease often causes an imbalance in the body's electrolytes, which can affect the nerves and skin, leading to the sensation of itching. If the itching is accompanied by other symptoms like swelling in the legs or ankles, changes in urine output, or high blood pressure, kidney disease could be the culprit. Chronic kidney disease, CKD, is common in seniors, and while it can be managed with proper medical care, ignoring the signs can lead to kidney failure and other serious health issues. Itching related to kidney problems may be a symptom of advanced stages of CKD, so it's important not to dismiss it as just dry skin or aging. Diabetes and blood disorders. In some cases, persistent itching in older adults can be a symptom of diabetes or blood disorders. High blood sugar levels in diabetes can cause nerve damage, neuropathy, which can lead to itchy skin. Additionally, poor circulation and dehydration, both common in diabetics, can make the skin more prone to dryness and irritation. Blood disorders, like anemia or polycythemia vera, a condition in which the body produces too many red blood cells, can also cause itching. These conditions often require specialized treatment to manage symptoms and prevent further complications. What you can do if you're over 60 and experience persistent itching that doesn't improve with over-the-counter treatments, it's important to see a healthcare provider. A doctor will be able to assess your symptoms, perform the necessary tests, and determine if an underlying health condition is causing the irritation. Early detection and treatment can make a significant difference in managing chronic conditions and preventing serious complications. In the meantime, it's important to keep your skin hydrated and protected, especially as you age. Use gentle, fragrance-free moisturizers, avoid hot showers, and stay hydrated by drinking plenty of water. However, remember that these measures won't address the root cause of the itching if there's an underlying health issue. Only a doctor can provide the proper diagnosis and treatment plan. Conclusion: that small itchy spot on your body might not be something to ignore, especially after the age of 60. While it could be a harmless irritation, it can also be a sign of a deeper issue within your body, one that may affect your overall health and lifespan. Persistent itching can signal liver disease, kidney problems, diabetes, or other serious conditions that require medical attention. If you experience this type of irritation, don't wait for it to go away on its own. Make an appointment with your doctor to rule out any potential health concerns and ensure that your body is getting the care it needs. Early intervention can make all the difference in maintaining your health as you age. Kidney disease and chronic itching. Chronic kidney disease, CKD, is a significant cause of persistent itching in older adults, especially those over 60. When the kidneys are not functioning optimally, they can no longer filter out waste products efficiently. As a result, waste accumulates in the blood, leading to a condition known as uremic pruritus. This condition causes the skin to itch, often intensely and across a broad area. Itching caused by CKD can be particularly troublesome at night, disrupting sleep and contributing to a decrease in overall well-being. Other signs of CKD include swelling in the legs and ankles, frequent urination, fatigue, and high blood pressure. These symptoms often occur gradually, making CKD difficult to detect in its early stages. If you notice persistent itching along with any of these other symptoms, it's important to consult a healthcare provider as soon as possible. Early diagnosis and management of kidney disease can prevent further damage and improve quality of life. Without treatment, CKD can progress to kidney failure, which requires dialysis or a kidney transplant. Diabetes and poor circulation. Diabetes, particularly when it's poorly managed, is another condition that can lead to persistent skin irritation and itching. High blood sugar levels over time can damage the blood vessels and nerves, which directly impacts circulation. As circulation becomes compromised, the skin becomes more prone to dryness, irritation, and itching. The legs and feet are often the areas most affected by poor circulation and can become particularly itchy as a result. In addition to circulation issues, diabetes can also cause diabetic neuropathy, a condition where nerve damage occurs due to prolonged high blood sugar. Neuropathy can cause a variety of symptoms, including tingling, numbness, and, of course, itching. This is often accompanied by a loss of sensation in the affected areas, which makes it harder to notice any damage or irritation until it becomes more severe. Diabetics are also at an increased risk of skin infections, which can further exacerbate itching. Skin infections, particularly fungal or bacterial infections, thrive in the moist, warm environment, often found on the feet and legs of diabetics. These infections can lead to itching, redness, and sometimes even open sores, making it essential for diabetics to pay close attention to skin care and seek medical treatment if necessary. Cancer and persistent itching, while it may not be the most common cause, it's crucial to recognize that persistent itching could sometimes be a sign of cancer, especially cancers that affect the lymphatic system, such as lymphoma and leukemia. These types of cancers can cause severe itching, often without any obvious cause, and may be accompanied by other concerning symptoms like unexplained weight loss, swollen lymph nodes, and fatigue. Lymphoma and leukemia are both cancers that impact the lymphatic system, which plays a vital role in immune function. In lymphoma, the lymph nodes become swollen and may feel painful or tender, and this can often coincide with skin irritation and itching. Similarly, in leukemia, the increase in abnormal white blood cells can lead to a range of symptoms, including itching. If you experience persistent itching, especially if it's accompanied by other unexplained symptoms like weight loss, fatigue, or swollen lymph nodes, it's critical to seek medical attention immediately. While the itch itself may not be a cause for alarm, it could be a symptom of a more serious condition, and early detection of cancer significantly improves the chances of successful treatment. Other potential causes of itching. While liver disease, kidney problems, diabetes, and cancer are some of the more concerning causes of persistent itching in seniors, they are far from the only possibilities. Other health issues can contribute to skin irritation as well, including allergies, eczema, psoriasis, or even certain medications. In some cases, dry skin is simply a result of aging, and while it can cause discomfort, it's usually not a cause for serious concern. However, for older adults, it's especially important not to dismiss any persistent symptoms, including itching, as just part of the aging process. The skin, as the body's largest organ, often provides critical clues about internal health, and persistent itching that doesn't resolve with typical treatments should always be investigated further. Conclusion: the importance of seeking medical attention. Persistent, unexplained itching, especially in seniors, is not something to be ignored. While it might initially seem like a minor inconvenience, it could be a symptom of a much more serious health issue, such as kidney disease, diabetes, cancer, or other medical conditions. If you or a loved one are experiencing consistent itching that doesn't improve with topical treatments, it's essential to see a healthcare provider for an evaluation. Timely diagnosis and treatment are key to addressing any underlying health conditions and preventing complications. Early detection can improve outcomes and allow for more effective management of chronic conditions. In the case of serious conditions like CKD, diabetes, or cancer, seeking medical attention early can be life-saving. Don't wait for the itching to subside on its own. Take action to ensure your health and well-being. Nutritional deficiencies and their impact on skin health. As we age, our bodies undergo numerous changes that can affect our nutritional intake and overall health. Seniors are especially vulnerable to malnutrition or vitamin deficiencies due to factors such as reduced appetite, difficulty chewing, or problems with nutrient absorption. When key vitamins and minerals are lacking in the diet, it can manifest as various skin issues, including persistent itching. Common deficiencies that affect skin health include vitamin B12, zinc, and vitamin D. Vitamin B12 is essential for red blood cell production and nerve function, and a deficiency can cause skin to become dry, pale, and more prone to irritation. Zinc is another critical nutrient for skin health, as it plays a vital role in collagen production and wound healing. A lack of zinc can cause skin to become inflamed and prone to rashes, itching, and other irritations. Vitamin D, known for its role in bone health, is also important for the skin. A deficiency in vitamin D can lead to dry, flaky skin, and may also contribute to the development of skin conditions like eczema or psoriasis. Ensuring that seniors maintain a balanced diet, rich in essential vitamins and minerals, is crucial for preventing skin issues. Including foods high in these nutrients, such as leafy greens, fish, eggs, and fortified cereals, can help improve overall skin health. In some cases, supplements may be recommended by a doctor to address specific deficiencies. Regardless, it's essential for seniors to maintain regular checkups with a healthcare provider to monitor their nutritional status and make necessary adjustments to their diet. Medication side effects and skin reactions. Many seniors take a variety of medications for chronic conditions such as hypertension, cholesterol management, or pain relief. While medications can improve health in many ways, they can also come with side effects, some of which affect the skin. Certain medications, like antihypertensives, used to lower blood pressure, statins, used to manage cholesterol, and pain medications, are known to cause skin reactions, including itching. In some cases, medications can trigger allergic reactions that cause itching, rash, or hives. Other times, medications can affect liver function, leading to the accumulation of toxins in the body. This toxin buildup can cause irritation and itching in the skin. If a senior notices that they begin itching shortly after starting a new medication, it's important to consult a doctor. The healthcare provider may suggest adjusting the medication, switching to a different one, or taking additional treatments to mitigate the side effects. It's important not to stop or adjust medication without first consulting a doctor, as this can have serious consequences. However, if itching or other skin reactions are persistent, it may be necessary to explore alternative medications that are less likely to cause such side effects. Dry skin and eczema in seniors. As the body ages, the skin undergoes several significant changes. One of the most common changes is the reduction in oil production, which leads to dry skin. Dry skin is one of the most frequent causes of itching in seniors, as the lack of moisture can leave the skin feeling tight, rough, and irritated. In addition to dryness, the thinning of the skin that occurs with age makes it more susceptible to irritation and injury. Eczema, a chronic inflammatory skin condition, also becomes more prevalent with age. Eczema causes patches of inflamed, itchy, and sometimes scaly skin. While eczema is not usually life-threatening, it can be extremely uncomfortable and may interfere with daily activities. Older adults may notice that eczema symptoms flare up in response to certain environmental triggers such as dry weather, soaps, or laundry detergents. Eczema can be particularly problematic if it's not properly treated, as the constant scratching can lead to skin infections or further irritation. Both dry skin and eczema are more common as people age, but they can usually be managed with the right treatment. Moisturizing lotions, topical corticosteroids, and other prescribed treatments can help alleviate the symptoms. It's important for seniors to establish a daily skincare routine that includes moisturizing to prevent dry skin and protect the skin's natural barrier. In the case of eczema, avoiding known triggers and using specialized creams or ointments can help keep flare-ups under control. Conclusion: understanding the root causes of itchy skin. Persistent itching is more than just a nuisance. It can be a symptom of an underlying health issue, especially for seniors over 60. Whether the cause is nutritional deficiencies, medication side effects, or common skin conditions like dry skin and eczema, addressing the root cause of the itching is essential for overall health and well-being. Seniors should take the time to monitor their skin's condition, pay attention to any changes, and consult a healthcare provider if they experience persistent or unexplained itching. By maintaining a healthy diet, staying hydrated, and keeping the skin moisturized, seniors can help prevent many of the common causes of itching. If the itching persists or is accompanied by other symptoms, it's essential to seek professional medical advice. Early detection and treatment of any underlying health issues can make a significant difference in a senior's quality of life, allowing them to remain comfortable and healthy as they age. Why ignoring an itchy spot could be dangerous when it comes to aging. Many people tend to shrug off certain symptoms as part of the process. A small, persistent itch, for example, may seem like something harmless, a minor annoyance that will eventually go away. However, as we age, our bodies are more vulnerable to a range of health issues, and what may seem like a trivial problem could actually be a sign of something more serious. Ignoring an itchy spot on your body, particularly after the age of 60, could be dangerous. Why? Because persistent itching may be one of the first noticeable symptoms of conditions that, if left unchecked, can escalate quickly and lead to long-term damage or even life-threatening complications. For example, conditions like liver disease, kidney disease, or certain types of cancer can manifest as skin irritation or itching. The liver and kidneys are responsible for filtering toxins out of the body, and when they're not functioning properly, toxins can build up and cause various symptoms, including itching. Liver disease such as cirrhosis or hepatitis, and kidney disease such as chronic kidney disease, CKD, can be far more manageable when detected early. If these issues are caught in their early stages, there are often treatments available that can slow progression or even reverse some of the damage. On the other hand, if left untreated, these conditions can lead to severe health complications and shorten lifespan. The same goes for other underlying conditions like diabetes and certain cancers. If you experience persistent itching accompanied by other symptoms such as unexplained weight loss, yellowing of the skin, swelling, or fatigue, these could be signs of a more serious health condition. Don't ignore these signs, as they may be the body's way of signaling that something is wrong. By seeking medical advice early, you give yourself the best chance of treatment and a positive outcome. Ignoring or downplaying an itchy spot can delay diagnosis, making conditions harder to treat later on. How to protect yourself from health risks. If you're experiencing persistent itching or notice a suspicious spot on your skin, it's essential to take action rather than ignoring it. Here are several steps you can take to protect yourself and your health. Get regular checkups as we age. Routine medical checkups become even more important. Regular visits to the doctor allow for early detection of potential health issues before they become severe. Many conditions, including liver disease, kidney disease, and even certain cancers, can be caught early with routine blood tests, skin exams, and checkups of vital organs. Early intervention can make all the difference in terms of treatment, options, and long-term health. If you've noticed an itchy spot or other unusual symptoms, it's important to bring them up with your doctor during your next appointment. They can examine the spot, run tests if necessary, and ensure that you're in good health. Stay hydrated and moisturize. One of the most common causes of itching in older adults is dry skin. As we age, our skin becomes thinner, produces less oil, and loses its ability to retain moisture. This can result in dry, irritated, and itchy skin. Staying hydrated by drinking plenty of water can help keep your skin moisturized from the inside out. Additionally, using a good moisturizer is essential. Look for unscented lotions or oils that can help lock in moisture, and apply them immediately after showering when your skin is still damp. Proper hydration and moisturizing can go a long way in preventing skin dryness and reducing itching. Watch for other symptoms. If you notice a persistent itchy spot that doesn't improve with moisturizing, or if the itching is accompanied by other unusual symptoms, it's important to seek medical attention as soon as possible. Symptoms like yellowing of the skin, jaundice, swelling in the legs or abdomen, unexplained weight loss, fatigue, or changes in urine color could be signs of a serious health condition, including liver disease, kidney disease, or cancer. The sooner you seek medical help, the sooner you can address these issues before they become more complicated. Remember that your health is worth the time and effort to investigate any concerning changes. Practice skincare and prevention. In addition to moisturizing, practicing general good skincare is important as you age. Regular bathing, avoiding harsh soaps that can dry out the skin, and protecting your skin from excessive sun exposure can help prevent itching caused by environmental factors. If you are prone to skin conditions such as eczema, using a fragrance-free hypoallergenic lotion can help reduce flare-ups. Keeping your skin clean and hydrated while protecting it from irritants is a proactive way to minimize itching and skin discomfort. Monitor. Your health seniors should keep track of any changes in their health, including new symptoms like itching or changes in skin appearance. Keeping a health journal can help you monitor your symptoms over time and provide useful information to share with your doctor. If you notice a pattern, such as increased itching at night, it could provide valuable clues about the underlying cause. Whether it's skin changes, digestive issues, fatigue, or changes in mood, noting your symptoms can help your doctor make an accurate diagnosis and develop a tailored treatment plan. Final thoughts. The takeaway here is simple. Don't ignore persistent itching or any changes in your skin. While it may seem like a minor inconvenience, it can be the first warning sign of a more serious health problem. By taking proactive steps, such as seeking regular checkups, staying hydrated, moisturizing, and staying aware of any changes in your body, you can significantly improve your chances of identifying potential issues early. Early detection and treatment are key to maintaining your health and extending your lifespan. Remember, your body is always communicating with you. By paying attention to those signals, like that itchy spot, you're taking an important step toward better health. Don't wait until it's too late to address your symptoms. Take charge of your health, listen to your body, and seek medical attention when necessary. Maintain a healthy diet. A healthy diet plays a significant role in maintaining skin health, especially as we age. Eating a well-balanced diet rich in vitamins, minerals, and healthy fats can help nourish your skin and prevent dryness, irritation, and itching. For example, foods rich in omega-3 fatty acids, like salmon, walnuts, and flax seeds, can help reduce inflammation in the body, promoting smooth, hydrated skin. Antioxidant-rich foods like berries, leafy greens, and citrus fruits can also protect skin cells from oxidative stress, which accelerates the aging process. Additionally, ensuring adequate intake of vitamins A, C, and E, as well as zinc, can support skin repair and regeneration. If you're unsure whether your diet is meeting all of your nutritional needs, consider speaking with a nutritionist or your doctor. They can help assess your diet and make personalized recommendations to ensure you're getting all the essential nutrients to support skin health and overall well-being. Sometimes nutritional deficiencies can lead to skin problems, so it's important to address any dietary gaps early on. Avoid scratching. When an itchy spot appears, the natural instinct may be to scratch it for relief. However, scratching can actually make the situation worse. It may provide temporary relief, but it can lead to further irritation, skin damage, and even infection. Scratching damages the protective barrier of the skin, making it more vulnerable to harmful bacteria. This can potentially turn a minor issue into a more serious problem, especially if the skin breaks open or becomes inflamed. Instead of scratching, try using a cold compress or gently patting the affected area to alleviate the itch. You can also apply an over-the-counter anti-itch cream, such as hydrocortisone, or use natural remedies like aloe vera gel or oatmeal baths, which can help soothe irritated skin. If the itching persists, or if the spot shows signs of infection, such as redness, warmth, or discharge, it's time to consult your doctor. Your doctor can recommend the right course of treatment to address the underlying cause of the itch, whether it's a skin condition, an internal health issue, or a side effect of medication. Conclusion. Listen to your body. While an itchy spot may seem like a small and insignificant issue, it's important not to ignore any changes in your body, especially as you age. For seniors over the age of 60, persistent itching could be a warning sign of a more serious underlying health problem. The skin is a reflection of your overall health, and unexplained or chronic itching could indicate conditions such as liver disease, kidney disease, diabetes, or even cancer. Ignoring these signs could delay diagnosis and treatment, potentially leading to more severe complications later on. The key to longevity and good health is not just about avoiding major health crises, but being proactive in identifying potential issues early. Listening to your body and taking notice of symptoms, whether it's an itchy spot or other unusual changes, can help you stay on top of your health. Regular checkups with your doctor, staying hydrated, moisturizing your skin, and maintaining a balanced diet are all essential steps to help you stay healthy and address issues before they escalate. If you or someone you love notices an itchy spot that won't go away or experiences other concerning symptoms, don't hesitate to consult a healthcare professional. Early detection is key to treating any underlying conditions, so make sure to keep an eye on your skin, your overall health, and any changes you experience. By doing so, you're not only taking care of your skin, but also ensuring that you're doing everything possible to live a long, healthy life. Stay vigilant, stay healthy, and always remember, your body speaks to you. Make sure you're listening. By being proactive about your health, you can take control of your well-being and continue to enjoy life with vitality and peace of mind.